We are here with one of the biggest names in the history of parodontology, implantology in the whole world, and this is Professor Zukeli. He doesn't need my words here for you to know how important is he for us all. I'm very proud to have you here, sir.
Nice to see you.
I'm so glad. In this very big and important event for the Bulgarians, my first question will be, of course, as Italian, as a professor, which is your favorite club, football club in Italy?
Yeah, you know, it's not favorite. There is only one club. There is one football club in Italy, and this is Bologna Football Club.
That was
the club of my city. And today there is a very important match for the Champions League.
I wish you luck. I wish you luck. I love Italian football. I love Italian football.
So much.
You have so many years behind you, and I have so many questions, but the most important for me and the Bulgarian market, your opinion, what can we improve in our lectures, what can we improve in our courses to reach the level of the Italian implantology, of the Italian dentistry? Your short opinion.
Yeah, I think that obviously the history of Italy is much longer, but for sure the biggest advantage of the Italian implantologists is that most of them comes from a periodontal background. So the periodontal background teach you how to treat patients also ethically and not only aesthetically. Ethically means you have to treat the patient when they are healthy, because we have to place the implant in patients that are healthy, and so you have to know how to make the diagnosis and how to make the treatment of periodontal disease. But to be a periodontist means also to have the skills in your hands to make a surgery which is very delicate, lot of details, and this makes the difference. So my suggestion is that you have to, you know, a little go back to perio and make as much as possible interaction between perio, implant, prosto.
Thank you for your answer. You have so much behind you, like inventions, protocols, books. I really want to ask you, have you a short story for the Bulgarians? What was the most important and the most exciting for you? All these years, 30, maybe more years, I can have 100 questions, but I want to feel your emotion with one invention that is the most important for you and the story behind it with 2-3 words.
I think that everything I did in my life was mainly oriented from the biological knowledge that I acquired in the, let's say, in the school of Gothenburg at the time of Jan Linde, where it was extremely biologically oriented school, and this is my imprint. So whatever I do, I try to make it biologically oriented more than evidence-based. So evidence-based, it's important, but in order to innovate, in order to improve, we have to try to think something in advance, and the only way to think in advance and to do something more is to think biologically.
I understand.
And for sure, one of the most important steps in my career was to introduce this corneally advanced flap that was at the beginning used only for the treatment of gingival resection. Now it's become a mucogingival approach that you can apply to many different conditions, implant, treatment of bony defect, so it's very important.
I understand. What are you most proud of in this whole long journey that you had?
The love of dentist. Wherever I go, I feel how much dentists believe in me and how much they really love me. Sometimes not personally, sometimes also personally, I mean, but everybody recognizes that what I did for my field, it was a very important step, and I think that people is very happy to meet me and to know a bit more. And this is most probably the most important thing I did. Wherever I go, I feel a lot of love by dentists.
I understand. A very short message for the young Bulgarian dentists
Yeah.
from you to them as the biggest professional.
The first step is to study. To study, you have to know the background. Once you start to know the background and once you start to practice, you have to firm a bit and try to think yourself, try to go back to the roots, which means to go back to the biological concept, and try to also improve, because if you are still in the past, we will never go further. While I think we need young guys, young minds that helps the old dentistry world to improve in the future. So I think that I believe that the new generation of dentists will be much better than the old one.
I understand, thank you, sir. And my last question is, of course, about Sweden and Martina. Your first touch, a few words, and something important from you as the biggest name there in the implantology, parodontology. What must we expect?
I think that the big changes and the big revolution around this implant is the shape and the surface of the transmucosal area, which is the area that is necessary in order to have the soft tissue seal for the bacteria not to penetrate and to reach the implant thread. So it's not how much bone do you have that protect the implant from the risk of perimplantitis, is how good is the seal of the soft tissue around the suprabony component of the implant. And from this point of view, the Prama implant is really the ideal solution, because it was really thought in order to provide the best integration of the soft tissue that has to be treated, obviously, in order to have an increase also of the thickness of them. But the great advantage of this implant is that the quality of the surface, it's really studied in order to have the best fiber integration, so the fibers can interact with this surface and create such a good seal that should prevent bacteria to penetrate and reach the thread of the implant. Once the bacteria reach the thread, it doesn't matter how thick is the bone resorbing anyhow. So the problem is to prevent the bacteria to reach the thread, and this is the great advantage of the tissue level implant. There is only one piece, but the tissue level component of this implant should be really perfect in surface, in dimension, in order to provide the good fiber integration and the good seal.
Thank you. Thank you for the detailed answer. I'm very proud that you're here. I'm thankful for the interview. I wish you the best of health for you and for your family, and
Thank
the
you
good luck
very
for Bologna, sir.
Thank you.
It was a pleasure for me.
Thank you.
Thank you
So much.